The most advanced treatment for cataract surgery is microcataract surgery. Let's see what microcataract surgery is. If this is the outline of the cornea and this inner circle is the outline of the dilated iris or the dilated pupil, we place an incision on the side of the cornea. Since it is on the cornea, which normally does not have any blood vessels, this does not bleed. Since it does not bleed, a person who has a heart disease, who is taking ecosprin or other blood thinning tablets, need not stop any of the tablets because there is no blood involved. Two supporting incisions are placed above and below. These are 0.3 millimeters and this is 1 millimeter. Through this 1 millimeter incision, we have to take out a lens that is 10 millimeters. For that, we remove the covering of the lens in a circular fashion so that there is a circular opening on the lens and we can access the lens material which is inside. Once we have made the circular opening, we introduce a cannula that injects water into this clear bag and separates the inner lens from the surroundings. We introduce another instrument and we dial the lens. We move the lens in a circular fashion so that it is free of all attachments within the eye. Once we have done that, we place a viscoelastic substance into the eye through the same incision so that it acts as a shock absorber within the eye. Since the viscoelastic is inside the eye, whatever turbulence or surgery that takes place inside the eye does not traumatize the fine structures of the eye. Once we have done that, we have to remove the cataract. For that, we place a probe that is 0.9 millimeters within the wound with water jets on the side and a central area which vibrates with ultrasound frequency. This ultrasound frequency liquefies the lens and makes it into a semi-solid matter. This semi-solid matter is then aspirated via the same probe and it is taken out. Once we have completed the full aspiration and the eye is very clear, we introduce the viscoelastic again so that it is ready for lens insertion. The lens is inserted through the same incision with an injector. The lens is rolled into the injector and it is injected inside the eye. Once it is inside the eye, it unfolds like a flower that opens. It unfolds within the eye and it settles there. And these incisions are then closed by pure water hydrostatic pressure. Just water pressure on the sides of the incisions cause it to seal. Such a sealing is very strong. It cannot be opened thereafter. And since the incisions are very tiny and do not bleed, it heals very fast within 24 hours. And a person who undergoes microcataract surgery can take head bath within 24 hours. He can go to work the next day. He can drive a car. He can cook. He can watch TV.